Okay, we're live on Facebook. We are recording. Okay. Well, thanks for joining us, everyone, here on Zoom and on Facebook Live. My name is Krista Gervon, and I'm the Communications Director at Princeton Integrative Health. And today I am joined by Dr. Conny Garefino, who is our chiropractor and functional medicine practitioner, excuse me. And today we're talking about breast health. We know how important it is to be proactive about breast health. And today we're going to be talking about a different type of screening that you may not have heard about called thermography, which we're offering at Princeton Integrative Health later this month, as well as in March. But we wanted to give you an overview about what the procedure is like and what the benefits are. So without further ado, we'll go ahead and get started. Dr. Conny, can you tell us a little bit about the procedure itself, what people can expect from this procedure of the thermography screening?
Sure. So thermography has been around for quite some time. It's been researched for over 30 years, and it basically is a picture that detects, it uses infrared light and detects heat changes within the tissue, and can show areas of increased vascularity that may be related to angiogenesis, which is the creation of a blood supply in a cancer situation. So it's a non-invasive screening tool that can be used as part of your breast health regimen, and can be really a nice option when thinking about other forms of breast screening for breast health.
Great. And how long does it take? About?
You're usually in the room anywhere from 20 to 30 minutes. There's a period of time where you have to kind of sit in a cooler room so that the heat in the tissue starts to sort of normalize and decrease. And then depending on the person that's doing the screening, sometimes they do an ice water bath challenge, which helps to sort of amplify any kind of vascular discrepancies from one side to another. So anywhere from 20 to 30 minutes, it's pretty quick. And it's just a picture. So it's totally non-invasive. There's no, squishing of tissue. There's no poking, prodding, anything like that. Your thermography technician sits about 10 feet away from you, takes pictures, has you sort of turn in a circle, and then you're done. So, yeah.
So very different compared to other tests.
Yeah, exactly. Yeah, it's definitely much more comfortable. I've had it done myself, and it's totally comfortable. It's not invasive at all.
Okay. Who do you recommend should get the screening, or is there a certain demographic age-wise?
So it's safe for all ages. It's safe to have done during pregnancy. I actually had one of my first thermography scans during my last pregnancy. It's also safe for while you're breastfeeding, if you had any concern and needed to have a scan done. It is more recommended for women that have dense breast tissue as opposed to fatty breast tissue. There is about breast density is one of the strongest predictors for failure of a mammography screening to detect cancer. So women that have highly dense breasts may have malignancies that are missed on a traditional mammogram. Mammograms, they detect about 98% of cancers in women with fatty breasts, but only find about 48% in women that have dense breasts. So if your last mammography report states that you have dense breast tissue, likely is they may have sent you on for ultrasound, or maybe they don't. But in that sort of scenario, when they're doing a mammogram, it's sort of like looking for a grain of rice in a snowstorm. Cancer shows up white on a mammogram, and so does dense breast tissue. So it's really hard to see. And so it's definitely more, if you wanted to say, like if a woman had a fatty versus a dense breast tissue, I would say this is a really great tool to use for women that have dense breast tissue, and your doctor needs to be talking to you about it. The person that's interpreting those mammograms, it's written on the report, and so they definitely need to be sharing that information with you so that you can make the most educated decision for yourself.
Yeah, and I personally can attest to that because I had my first mammogram last year because my mother was a breast cancer survivor, and I went in for my mammogram. They got the results. They called me back, but I missed the call. I called them back, and they were like, "Yeah, we're not sure. We think we need you to come back in." And sure enough, I came back in, had to go through that whole uncomfortable test again,
Mhm.
and for them to tell me I have dense breast tissue and that everything was fine. But it was a stressful couple days and uncomfortable, quite frankly. So this is for me to have learned about it was such a relief that I can go do something that's actually better at detecting a malignancy on dense breast tissue that isn't going to hurt and be so uncomfortable. So
Yeah, it may definitely pick things up earlier as well, because it's showing the heat signature of what's going on. It can actually detect cancers and malignancies earlier than the structural tests like mammograms or ultrasounds. And the other thing to remember about a mammogram is it misses the entire upper portion and the axilla
mhm,
of that area because it is only focusing on the actual breast. Whereas, ultrasound can see the whole picture. Um, and so is good for as a follow-up if something shows up either on a mammogram or a thermography scan. You can always use the ultrasound as a follow-up. None of them are actually diagnostic out
mhm,
of the three. The real only diagnosis is to do a biopsy following any of these tests. And but thermography does look at the entire area, it looks at the entire chest area as well as the axilla. And most breast cancers are actually they start in that upper outer quadrant and in the axilla. So it's a really important part to not miss.
right. So would you say that a thermography screening could actually replace a mammogram for some people?
Possibly for some people, based on the density of your breast tissue, it may be a good option to choose. And, like we were kind of talking beforehand, in utilizing potentially thermography and ultrasound as opposed to mammograms and ultrasound, especially in a higher risk population. But it could potentially be used as opposed to for certain people. Yeah.
Okay, awesome. And then is thermography used for any type of other screening, like besides your, breast health screening?
Yeah, actually. So thermography, because it picks up the changes in heat, one of the other common uses for thermography screening is actually inflammation and or the detection of suspected infection in the mouth as a result of root canals. So root canals are the only medical procedure done that leave dead tissue in the mouth. They remove the pulp, they remove the blood supply, killing the nerve, so that just this dead tissue and they sterilize it and they fill it, but nothing's truly sterile in the mouth. And so it can lead to a festering low grade infection over time. And unless it abscesses, which often it does, but can take years. So a thermography scan can actually pick up on if there's heat in this area that also can come down into the neck and can really cause a lot of issues and chronic problems in people's health. So thermography you can have a face and neck picture taken as well, which is great.
Um, that is so interesting that, it's been used for other things too. Um, Back to the actual screening itself, is there anything that people need to do to prepare for their appointment?
You will get a list of instructions, but really it's more about not doing anything that would increase or decrease to an extreme the temperature
Mhm.
of your arm slash axilla slash breast area beforehand. You know, there's directions like not putting lotions and things on the day of your appointment and not wearing underwire, because that can certainly affect blood flow and put pressure on areas beforehand. So there's a list of sort of directions of things to avoid for the day or a couple days beforehand, but you'll get all of that information once you make your appointment with Charlie, who is our thermography technician coming into the office to do the scans for us.
And then once the results are interpreted by Charlie, she goes through everything with you. What are the next steps, depending on what they find?
Well, so what actually happens is Charlie takes the pictures, and then it gets interpreted by a clinic in Canada, and the doc there, that's what he does. He does all the interpretations. He writes up the reports, and then Charlie will give you a call and go over the report with you. And if there is any sort of suspicious, you know, findings on the tests, then you go in for follow-up testing, whether that be the recommendation is either an ultrasound or a biopsy, depending on what is found, to proceed that way. Usually once a year is recommended for people that haven't had some sort of diagnosis or prior issue, maybe more often if you have. But really the best part about the thermography, or the way that we track over time, is the changes. You want things, they look at things bilaterally, meaning both sides, and they track changes over time.
Okay.
Being consistent with your scans is also important.
Okay. Is there any other information you want to provide about the screening itself, or about breast health in general? Otherwise, we can open up to questions, and I can see if there's anything going on Facebook too.
So the only other thing I would say is, you know, that when I speak about the breast density, this isn't something that's always been that women's doctors haven't been as forthcoming as they need to be, giving women that information. So just knowing that you as a patient, that's a really important question to ask, because you having a mammogram with dense breast tissue may not be the best option for you. And now, you know, there's a lot of legal things going on to help give women more of a voice, and to make sure that on those test results, it is reported, so that you know how to best proceed with testing.
Awesome. We don't have any questions on Facebook. We do have someone who just popped into the waiting room, so I'm going to let them in. So if anyone else has any questions about all the information that Connie provided, please go ahead and either unmute yourself, or you can type it in the chat. If you did miss part of the presentation, it's available on Facebook. We're on Facebook Live right now, but it'll be recorded for anyone who wants to rewatch it or share it with someone who might get valuable information.
The only thing I think else that's worth mentioning is that we are going to be doing thermography screenings in our office. We are doing them the last week of February and the first week of March. Charlie Erica Falls, who is our thermography technician, she's wonderful, will be coming into our office to do the scans. So we will follow up with, there's our contact information to call and schedule.
I believe it's February 26th and March 5th.
Yes.
So you can call our office, and Lisa or whoever's answering the phones will be able to let you know what times are available and what you need to do to prepare for your appointment.
Yeah, to get anybody scheduled that's interested in coming in.
Yep. All right. Well, I think if there's nothing else, they don't have any questions on Facebook either. So, but if anyone does have questions that come up, you know, afterwards, please, again, you know, feel free to call our office at any time. You can email us at info@princetonih.com as well. And obviously, we're happy to answer any questions you might have.
Thanks so much, Krista.
All right. Thanks, Dr. Connie.
Everyone for coming.
Have a good day, everybody.
Thank you.
Bye. Thanks, Colleen. Bye.
See ya.
See ya.